Really from day one of my medical training, taking care of soldiers, sailors, airmen, and Marines, as well as their families, has been just kind of a core tenet. As I got done with my active duty time, I was not ready to let that go, right? I did not want to go to, purely civilian facility. I love taking care of vets. I love taking care of active duty. I understand what they mean when they say, hey, I'm getting ready to deploy and I'm worried about my wife, or hey, I really need to get my kids taken care of because I'm about to leave to go into NTC, or we're in the middle of a PCS move, just arriving to Fort Riley, just leaving. All the kind of upheaval that can cause. I understand all that. They don't have to explain the acronyms to me. They don't have to, I lived that life for 8 years. I get it. And that was something where I dearly love that patient population. That is something where, I think in a lot of ways, that's something where in some ways it's underserved, honestly, right? And it's just because the military community can be a little insular. I think sometimes people find it kind of hard to break into the military healthcare system if they don't have a tie-in, like a vet or like somebody that had served. But that patient population, that is something that, this is the way I felt like I could continue a calling to serve the country. Even though I wasn't going to be wearing a uniform anymore, this was something where I can support those that do, right? And I felt like that was very important. I think that's a very kind of animating thing to why I do what I do. And it's been with me again since the beginning of my medical career. I wanted to continue that. I did not want to let that go after just 8 years. Kind of first thing that comes to mind, it wasn't just one patient. It was actually 7 soldiers. Were out, in the middle of the night. I primarily work nights here. And they were out doing night land nav in a vehicle. They were in a Bradley, so a big kind of armored tank kind of personnel carrier thing, and they rolled it, and so they were all injured. Part of my job here is I also take care of EMS. I'm the EMS medical director for both EMS as well as the firefighter, first responder thing here in Fort Riley. That obviously generated a big response from us. We had 7 casualties, kind of unclear how critically injured they were. They got some point of care, first responder kind of stuff from their unit, but then they were rapidly reaching back here to the hospital. And we dispatched a bunch of assets out there. Ended up actually sending 3 ambulances to collect all these folks. As they got to us, this is something where I know the uniforms they're in. I know what they mean when they say they had a K-pot on or a Kevlar, or a chicken vest or all these other things, and knew kind of right away what that meant with a Bradley, this multi-ton vehicle that's rolling, right? And so very quickly we were able to sort through those things, figure out who was most seriously injured, get them through, the whole kind of trauma activation here at the hospital, figure out who was severely injured or not. Luckily, bruised, kind of battered, but nothing that was critically injured, right? And then we can flip and we can talk about duty status. When can you go back to duty? What are going to be your limitations from a duty standpoint? And, I'm able to, really pretty seamlessly interact with, first sergeants or commanders or any of those other things, because we kind of speak a common language, right? And that was something where my piece of that puzzle as a brigade surgeon just a few years ago, I was more in the field with them, kind of starting that response. Now I'm on the other side of it in the ER, kind of at the other end, or the finish line, so to speak, of that. But luckily, all these people were okay, right? All these injuries are going to heal, nothing life altering. We're able to talk to those families who had heard, hey, my soldier was injured in the field, what's going on? And luckily it was good news, right? And so that was something where this is exactly why we're here, why 911's here, why EMS is here, why fire is here, why the ER is 24/7, why we do what we do, because my team, really did just an absolute wonderful job, from the charge nurses to the bedside nurses to the radiology techs to the lab techs. Everything worked, and we were able to take care of them very quickly. And that is something that I absolutely pride myself on, as we're able